The American Cancer Society, more than 19,000 women will receive an ovarian cancer diagnosis this year.
So here to tell us about the warning signs during Ovarian Cancer Awareness Month is Dr. Kathy Laflavor. Dr. Laflavor, good to see you. Thanks for being with us.
Good morning.
So ovarian cancer is called the whisper cancer. What does that mean?
Well, a lot of the symptoms that present with ovarian cancer can be very vague and can be caused by a lot of different disease processes. So many women ignore the symptoms, and by the time they present to the physician, it can be at an advanced stage.
And can you tell us about a few of those symptoms? Some is, it's like bloating and constipation. What are things that can happen naturally with a woman's cycle? So what are some of those symptoms?
Right, so common symptoms include pelvic and abdominal pain, as well as changes in weight, and can also have early satiety, which is a symptom where you get full easily, and then bladder and bowel changes and increased fatigue. So there are a lot of things that can cause these, but if a woman is aware of their body and changes, then hopefully they will be aware and know to seek medical care sooner than later.
Is there a blood test or screening that could detect it?
Unfortunately, there isn't a good screening test for ovarian cancer like there is for cervical cancer with the pap smear. There is a blood test called a CA-125, which can detect the protein in ovarian cancer. However, this can be elevated in a lot of other symptoms also. So it is most sensitive in women that have already gone through menopause also. So it can be elevated for a lot of other reasons other than ovarian cancer.
And who is most at risk of getting ovarian cancer?
People at risk for ovarian cancer include those that are older. The average age of diagnosis is around the age of 63. Women that have a family history of ovarian cancer obviously have an increased risk, as well as those that smoke cigarettes, have a history of infertility, endometriosis, or polycystic ovarian syndrome.
What do you suggest should a woman get a diagnosis of ovarian cancer?
I think the biggest thing is to be aware of your body. If you're noticing changes in some of these vague symptoms, don't be afraid to see your physician. I would rather have 1,000 people come in with these symptoms and we do an ultrasound and make sure everything is okay, than one person put these symptoms off and come in and be diagnosed at a later stage with ovarian cancer.
Are there protocols that someone can do when they are diagnosed? What are some of the best steps to take?
So the best step would be to see your physician as soon as you're having symptoms. An imaging test such as an ultrasound should be ordered. And if there's anything found on ultrasound, then a CA-125 may be ordered. If there's a high suspicion for ovarian cancer, then you need a referral to a GYN oncologist who specializes in cancer of the female organs. And the diagnosis of ovarian cancer can't be made for sure until surgery is performed and the mass is removed and looked at underneath the microscope.
All right, that's Dr. Kathy Laflavor with us this morning. Dr. Laflavor, great to see you. Thanks for those ideas. We appreciate it. Have a good one.